Hello everyone, my name is Daniel Tesolin and I'm a fourth year medical student at the Northern Ontario School of Medicine. Over the past couple of years, I've been working with my supervisor, Dr. Ryan Patchett-Marble, on a smartphone application that can assist healthcare providers accurately interpret the results of urine drug tests. The app is called Urinterpret, and over the next 10 minutes, I hope to explain why we need this app, give an overview of what the HARMS program is, and hope to convince you to start using urine drug testing as a way to make informed decisions when prescribing opioids for non-cancer chronic pain. Dr. Ryan Patchett-Marble is a rural generalist that has been practicing out of Marathon, Ontario for 7 years. He, like many others in recent years, is interested in addiction medicine research, especially opioid addictions. Marathon is no exception to the wide-reaching effects of addiction. I'm sure it is not new information that opioid addiction in Canada have reached epidemic levels and that it disproportionately affects rural northern communities. This has left physicians in a complicated situation, as they have a tremendous responsibility to reduce unnecessary opioid prescribing to mitigate the risk of addiction while still treating their complex chronic pain patients effectively. Determining a patient's risk of addiction is typically based on subjective information about their pain and social behaviors. This leaves a lot up to interpretation. There is unfortunately currently no objective test for pain, but there is a surrogate objective test that can help us elicit a patient's risk of substance misuse. That test is urine drug testing. Urine drug testing can be used to determine which patients have substance use disorders, as well as be used as a monitoring tool to measure adherence to a current opioid regimen. It gives objective information that is valuable in risk stratifying patients in terms of their risk of addiction. Urine drug testing is available as point-of-care immunoassays, which are cheap and quick tests, or in the form of confirmatory testing with liquid chromatography mass spectrometry, which is extremely accurate compared to immunoassay, but takes more resources to obtain. Unfortunately, there is currently not a lot in the way of high-quality literature assessing the usefulness of urine drug testing as a decision-making tool when prescribing opioids for non-cancer chronic pain. To evaluate urine drug testing as a decision-making tool, Dr. Patchett-Marble and the Marathon Family Health Team developed a program officially named the HARMS program, which stands for High Yield Approach to Risk Mitigation and Safety. Essentially, what the program does is utilize random urine drug testing results to risk stratify patients either up the risk ladder towards the harm of addiction or down the ladder where benefits of opioids outweigh the risks. Based on the location on the ladder, prescribing and monitoring habits are modified. Prescribing habits were monitored in a small study after 12 months of implementation of the HARMS program in the community of Marathon, Ontario, and the study showed that nearly 20% of the low-risk patients had management or monitoring decisions changed based on the urine drug results. This was evidence that the HARMS program works and that urine drug testing has an impact on clinical decision-making. This information is promising for changing the way we practice our opioid prescribing as primary care providers, but the literature states that one of the biggest barriers to the utilization of urine drug screening is interpretation. Studies show in general we are not good at interpreting the results of immunoassay or confirmatory testing. This is because the tests have many false positives and cross-reactivities that we are not always aware of without a thorough knowledge of drug metabolites or assay performance. Not understanding the results of urine drug testing could result in inappropriate discontinuation of opioids, which can be harmful to the patients and may place the provider in a bad position legally. This is where Urinterpret comes in. Over the past couple of summers, I have compiled data on false positives, false negatives, drug cross-reactivities, sensitivities, and specificities from the literature. I have also compiled the detection windows for each drug panel to know how long a compound will last in the urine after consumption. Lastly, I have also compiled all the metabolites each drug will produce on LC-MS confirmatory testing, which to our knowledge has never been included in any similar smartphone application of this kind before. Keeping this large amount of data in mind, we began to design how the app would look visually and how we wanted the app to behave upon user interface. This sketch represents the blueprint that was sent to a software engineer for app design. Today our app, UrinTerpret, is available for download on the Google Play Store. Let us demonstrate some of the app's capabilities with some cases. You have a patient, let's call him Pepe, and you prescribed him codeine for their chronic mechanical back pain. He has been using it for several months now. Because your clinic uses the HARMS program, you have him complete a random urine drug test to identify his compliance or to identify other non-prescribed substances he is using concurrently. He takes the test, and at first glance, the result appears unexpected because it tests positive for morphine, which is not prescribed by you. It is negative for cocaine, benzodiazepines, oxycodone, and methadone metabolite. Is your patient using opioids not prescribed by you? Let's check UrinTerpret before we make a false accusation. I've opened my phone and selected the UrinTerpret app from this screen. First, we select the quick UDT icon from the home screen. Then we choose immunoassay as our testing method. Then we select my panel is positive. Why? Then we choose the panel which was positive, which in our case is the morphine panel. This shows in green all the drugs that are highly likely to cause a positive panel. Yellow is for drugs that are less likely to cause a cross-reactivity but still possible in high concentrations, and blue for other compounds that can cause a positive result, such as fluoroquinolones or rifampin in this case. We see that codeine has a high likelihood of causing the morphine panel to become positive. The results we have should actually be expected. You can always send the urine for confirmatory testing if the answer is still unclear. Let's say we have a second patient, Urine, who has been prescribed oxycodone for their chronic pain. You want to know if they have been taking it or if they've been using other street drugs. You get a urine for drug testing, but you're unsure what test results you should expect. Again, we can check our UrinTerpret quick urine drug testing application. But this time, we can select my patient ingested a certain drug. What panels will be positive? Then we select oxycodone as our drug of interest. We see the oxycodone panel should be positive, but there is a chance that the hydromorphone, morphine, or general opiate panels may be positive in high drug concentrations. We don't see cocaine, amphetamines, or benzodiazepines, so we don't expect those to be positive unless she is also taking other medications or substances. If we are unsure about an immunoassay result, we can always send the urine for confirmatory testing by LC mass spectrometry. Let's go back. This time, we select GC-LC-MS as our testing method. Then we select what metabolites can I expect from a certain drug. Then select oxycodone as our drug of interest. We now have the results we expect from the test, so we can interpret it correctly when we get it back. We are very excited about the launch of the UrinTerpret app and expect it to be available on the Apple Store soon. Of course, more research is required to see how much urine drug testing helps with opioid prescribing decision-making, but we hope the UrinTerpret app will facilitate this research. There are plans to disseminate the HARMS program out of Marathon and into other communities to assess its efficacy. As the HARMS program expands, it is our hope that clinicians like you will consider using the UrinTerpret app along with urine drug testing as an adjunct to your daily opioid prescribing practice. I hope you enjoyed this presentation. Thank you to Dr. Ryan Patchen-Marble and the Northern Health Research Conference staff. Check out our website at harmsprogram.ca for more info and feel free to download UrinTerpret today.